Hello everyone, guess what? Dr. Fanny Yacaman again. Today we're gonna talk about this little simple floss. It's called dental floss. How is important this thing? You know, what is important of a dental floss in our lives? Nowadays, I think people is getting more conscious, but I've been in practice in Beverly Hills for more than 20 years. I don't tell you what. Then before I was in Century City. And since I went to USC, I was teaching my patients how to brush and floss. Floss first, brush later. You have to, I always remember this. Remember the middle finger in America, right? Everybody is mad and give the middle finger. So why is this little piece important? Everyone that I know says, well, I don't floss at night. I really try to floss in the morning, but it's just really difficult for me. So I just want to let you know that I just don't floss. Or they said, the floss? Do we really have to use it? And I said, well, just look at this picture. I'm going to show you now on the computer. If they had trouble with this technique, which we're going to go again, and I did it in my program, an episode, probably 2 for kids, 3 for adults. Please go there, memorize this technique and the floss, because I guarantee you, even though my mentor said don't guarantee, but I promise you that if you follow up that technique, the flossing, plus all the recommendations I've been giving in the past episodes about camera, about risk, how risk you have, the decay, how you're gonna take care of it, then you're gonna realize, oh my God, the floss is important. Talking today, and I hope he watches this episode with my broker of the insurance, which I adore. He's a very great in customer service. He says to me, thank God you're doing this program, because my kids are so into the flossing that every time I brush my teeth, they said, when are you gonna floss, Dad? And I corrected to him, because apparently it's better to floss first and brush later. Dr. Vijak also advised that. I was doing a reverse, but now I floss first and brush later, because I take all the crap out, the food, the leftovers, everything that we can have between the teeth. But why is it important? The brushing is important. We're going to talk later about that in another episode, only about the brushing. But today is why it's important, the dental floss. Well, why this little thing is very important. And if you don't have it, you can try to find something similar in places, in countries where you don't have access to a pharmacy close to you, which I don't think that happens in America. However, you never know. But all around the world, if let's say you don't find, by any chance, there's no way, or sometimes, I don't want to talk about politics, but there are some countries that they don't have everything that they need to buy. And try to find something that can go between your teeth, because if you don't use it, this calculus that you see that is so ugly, is produced by not flossing and not brushing correctly. Definitely this patient, if you look at between the teeth, has never flossed. Why? Because the way you're gonna put the floss, I'm gonna say at the end, and I'm gonna rush because I don't wanna be more than 10 minutes, and I'm looking at my time with my producer. If you look at this is the same patient, right? So when you have this patient here and you clean the teeth, you can almost say, oh my God, I got rid of all this by cleaning. Cleaning with a machine that I have videos about it. If we don't have it in all the videos, once in a while I will throw one of my videos that I take directly from my patients in the office when I'm teaching them. One of them is my mom. And you're gonna see that difference. And I will show you now. Actually, you will laugh, and I have my toothbrush in here. We're gonna talk about brushing later. But if you don't floss, what is gonna happen? When I show you the patient at the beginning, it was in this situation, and this situation, and the patient was 70 years old. And I said, do you wanna have a mouth like this? Do you wanna have this type of mouth? Or you wanna have this type of mouth? Do you have a smile that you can have the fabulous smile, and even if you don't have straight teeth and not too white, well, he did actually. He followed the guidelines. And when I was following him every appointment during several root canals, this patient used to have root canal after root canal, and every year have a couple and another root resorption. He was grinding, not wearing the night guard every night, not wearing during the stressful time in his life. And look at the difference of him having this type of calculus in his mouth, then come back when I was following up and no calculus at all. His life changed. He haven't had caries for 2 years. And now he grinds, look at this. He has all these stains in January because the other one was like 6 months before. And when he comes 6 months later to check up his teeth, the root canals I did, I check again his brush. And I love my patient because he brings his toothbrush every time and electric toothbrush with him. And then he has these results. So if you don't want to have this type of problems and have plaque and calculus accumulated, you need to follow my technique I give in episode 3 about how to floss, although I'm going to repeat it now quickly for you. But look at the difference of this patient. He said I changed his life. Unfortunately, in an attempt to save this tooth, he cracked it for grinding reasons and it was too weak. But now he has a more healthy mouth. And you have to choose. Do you want to have a smile like this, even if it's not too bright, too white like this, the gums that are look very healthy in a pink color, or you want to go back and have the mouth that I'm showing you at the beginning of this lecture like this? You choose. But for now, I will tell you that this piece of floss has to be divided by quadrants, right quadrant, lower left, lower right, and I tell you quickly, you right there, do it like this, very strong, small space. You go when you're in front, all the way to the back, all the way. Push it with this, and you do this, and you take it out. When you do that, you're gonna have like a piece of napkin. My teeth are clean now, and then clean it. Still I'll clean. I have bacteria in the mouth. I just drink water. Helps the pH, remember, of the saliva and the mouth. And you go to the next tooth again, and then you do like a horse, like a shoe, like you wiping the shoe. And after that, many patients you follow all the way down. This is the most important. But if you follow it, step 1 from here, then lower, then you don't have to go inside because it's coming up. And the movement is one side and the other. It's okay. Or one side and the other, and that's okay. A lot of patients now said they love this. I used to hate it, but now I love it. What do you do with this? It's easier. Any company have it. I found this company that uses, is stronger, the floss doesn't break, but if it gets stuck, immediately go to your dentist. This is a sign that you have a broken restoration or caries. Do the same from the back, easier, one side, the other, out, and then you're gonna continue with the front, and you go one side and the other. As long as you take care of as much as you can of all the surface, you're gonna be okay. If you have more questions, go back to that episode number 3, I think is for adults, and episode number 2 in English is for kids. And you're gonna have this type of a smile. Look at the gums, pink. This is the normal color of a patient, not this one with all this inflammation. Take care, have a good evening, and I hope if you have comments, subscribe to our channel, Dr. Fanny Yacaman, put a like, and Instagram and TikTok. Take care.